Welcome, parents. Thank you so much for tuning in to this webinar, which is ADHD versus autism, the differences, the similarities, and an effective care plan to unlock your child's full potential. There's a lot of joy that is involved with raising children, but there's also a lot of questions, especially when they start to experience or show some symptoms of ADHD or autism. And because there's such an overlap in between the two conditions, it can lead to a lot of misunderstanding, a lot of not knowing where to look or how to differentiate between the two, or really how to help them, because if you don't know what they're experiencing, you don't know the appropriate care to give them. So first, we're going to get some of the horrible statistics out of the way. 1 in 9 children are diagnosed with ADHD, while 1 in 36 kids are diagnosed with autism. So furthermore, that 60% of children with autism show ADHD-related symptoms, and 78% of children have some sort of co-occurring condition alongside of the ADHD things that they are experiencing. So is your child's difficulty making friends more autistic related or ADHD impulsive related? Could their intense concentration on their favorite topic be more ADHD obsessive or autistic related? In this webinar, we'll explore the similarities and the commonalities between the two conditions, as well as shedding light on the symptoms, the cause, and more importantly, the neurologically focused approach to care. So what we first have to understand is the types of different ADHDs. Now, there's an estimated of 7 million children are from 3 to 17 have been diagnosed with ADHD, which is 11.7% according to a national survey of parents. So there's 3 primary different types from the DSM-5. There's the predominantly inattentive, so these kids struggle primarily with focus, organization, and following through on tasks. Then we have the predominantly hyperactive, impulsive type, such as the fidgeting, the interrupting, and having difficulty sitting still. Then we have the combined type, which primarily speaks for itself, right? It's both of those mixed together. So some kiddos can have struggle with organization, but are often fidgeting and interrupting, and vice versa. So now we have to understand the differences with autism. So autism is a complex neurodevelopmental condition characterized by persistent challenges in social interaction, communication, and restricted or repetitive patterns of behavior, interests, or activities. So the term spectrum suggests that there is severity and presentation of these symptoms can vary widely from one individual to another. And that's how we look at children here in this office. No child is made the same or is the same, so they deserve to be treated uniquely. And as well as according to the CDC in 2023, approximately 1 in 36 8-year-old children has been identified with autism spectrum disorder. While the traits of autism typically begin to manifest in early childhood, some children may not receive a diagnosis till later in life because that spectrum is so broad. So some things that children with autism often face significantly are difficulty initiating and maintaining social interactions, troubled understanding and responding to social cues, delayed or atypical language development, intense preoccupation with specific topics or objects, and sensory processing differences, such as heightened sensitivity to certain sounds or textures. So there are obviously some similarities between both autism and ADHD, such as difficulty with social interaction, attention issues, and sensory processing difficulties. But there are also other co-conditions between ADHD and autism. So the high occurrence of ADHD and autism further complicate this overlap, right? Studies suggest that approximately 12.5% of children diagnosed with ADHD also have an autism diagnosis, while 30 to 35% of children with autism experience ADHD symptoms. And additionally, about 2/3 of those individuals with ADHD show features of autism. So research shows that there is indeed a genetic factor between both conditions, with studies suggesting a hereditary component. But it's also important to recognize environmental factors such as toxins, early use of antibiotics, birth trauma, maternal stress during pregnancy have also been linked to an increase of diagnosis with these conditions. We routinely find that children struggling with neurological components of both autism and ADHD also have issues with gut health, immune system dysfunction, and neural inflammation, and motor tone and coordination issues. So now that we've talked about how these conditions are similar, now we need to talk about the differences between the two of them. The first one is social interactions and communication. So with ADHD, children may struggle with social interaction because of the impulsivity and inattention, but they generally have a better understanding of social skills and desire to engage with others. But with autism, these children have more difficulty interpreting social cues and may show less interest in social interaction. They also may have trouble with nonverbal communication, such as eye contact and facial expressions. Next, we have repetitive behaviors and routines. So repetitive behaviors are not a core feature of ADHD, although some children may engage in fidgeting or other repetitive action due to hyperactivity or restlessness. But then autism has a restrictive, repetitive pattern of behavior, interests, or activities, which are a key diagnostic criterion for autism. They also may have a tense preoccupation with specific topics or objects and may struggle with changes in with changes in routine. Now, one of the big ones is attention and focus. So kids with ADHD often have a difficulty sustaining attention on tasks that are not highly rewarding to them, but they also may be easily distracted by external stimuli and struggle with organization and task completion. Now, children with autism may have these also intense areas of focus to the point of becoming hyperfixated, but they also struggle with shifting attention between tasks or topics, especially when it involves something they are not particularly interested in. Now, the age of onset is a little different. So symptoms of ADHD begin in childhood. The average age of a diagnosis is around 7 years old. And autism can be seen and recognized as early as 12 to 18 months, but most children are not officially diagnosed until they're about 3 years old. We understand that ADHD and autism are not solely genetic or predominantly brain differences. Instead, we view these conditions through something called the perfect storm framework. This is anything related to the maternal stress in pregnancy, birth trauma, early use of antibiotics, which highlight the role of nervous system development and dysregulation in those neurodevelopmental disorders. So the accumulation of these factors often overwhelm the brain and the nervous system and lead to subluxation, which is a condition characterized by nervous system interference, imbalance, and dysfunction. Subluxation can contribute to dysautonomia, which is an imbalance within the autonomic nervous system that regulates crucial functions such as heart rate, breathing, digestion, immune response, hormonal imbalance. The list really goes on when it comes to what dysautonomia can affect. So by addressing subluxation and dysautonomia, we can target the root cause of autism versus ADHD, rather than simply managing symptoms and relying on other pharmaceutical interventions. So the perfect storm refers to a combination of factors that can disrupt your child's nervous system development, such as fertility challenges, which can lead to prenatal stress and maternal health issues, birth interventions and trauma, such as C-sections, forceps, vacuum extractions. Then we have the early life stressors and environmental factors such as toxin exposure or emotional trauma. We have the overuse of prescriptions, vaccines, and other antibiotics, and early and continued exposure to the environmental toxins and chemicals. So this just sounds like a perfect storm, right? Like a spiral your child just can't get out of. How does neurologically focused chiropractic care help with ADHD and autism? So first of all, we have to say your child was created uniquely and they deserve that same approach when it comes to their health, right? So we use advanced diagnostic tools such as the insight scans. These scans help identify the areas of dysautonomia and subluxation within your child's nervous system. And then from their story and these scans, we develop a customized care plan suited to your child's needs. But there are some common side effects that come along with neurologically focused pediatric chiropractic care, which is better sleep, better focus and social engagement, and reduced anxiety over time. So there definitely is a path forward for these kiddos because every child deserves to reach their full potential, regardless of the neurodevelopmental challenges. So we totally hear all of the frustration and the confusion from these parents with ADHD and autism, but we also pride ourselves on providing compassionate, neurologically focused care to help those families and transform the lives of their children with these chronic conditions. By listening to these parents and conducting comprehensive assessments, we develop personalized care plans that address the root cause of challenges at a deeper foundational level than any other clinical approach or intervention. We also have a team-based approach because working with other providers is something we are meant to do. So we are here to be a team with you parents, as well as other professionals such as PTs and OTs and speech, nutritional providers. The list goes on, because we were designed to be integrative healthcare, not a one size fits all or a very much like we are the only ones that can help your child. So once the nervous system is better balanced, regulated, and functional, the other therapies and interventions that have previously been ineffective now have a more profound impact and effectiveness in your child. That concludes today's webinar. Thank you so much for tuning in or watching at your own time. Now, if you have any questions, please leave them down below. Share these with your friends and family members with kiddos who have ADHD and autism, because we would love to get them scanned, see how their nervous system is doing, and really unlock their full potential and their true awesomeness. Otherwise, if you are not located in Alaska where we are, there is a huge directory of doctors around the country and a few other places around the world who provide the same type of care. So there will be a directory for you to look up the closest one to you. Otherwise, all of our social medias will be linked down below to get connected with us, as well as our website, other stories of success and hope, and the best way to get in contact with us. So thank you so much for tuning in, and be well.